Hello. So today we're going to be talking about Alzheimer's, all right? This is a MedSpire presentation. Okay, so first, what is Alzheimer's? Well, Alzheimer's is a disease that affects the brain, and it makes it harder to remember things and think clearly and doing normal everyday tasks. And over time, it will worsen, and it can make even the simplest things and tasks difficult, such as talking or recognizing different people. How many people have this disease? Well, currently, about 55 million people have Alzheimer's or other memory-related diseases, and this number is growing even today. And it mostly affects older people, especially those over 65, and women are more likely to get it than men. This also affects friends and family because they would need to help care for their family members, and it would have a deep emotional impact seeing their family members not being able to recognize them. Now, first, to understand Alzheimer's, we must first understand how the brain works. Now, the brain is like a supercomputer, and it helps you think, remember, and control everything that you do. And it has different parts that work together, such as memory and decision making and movement. And in Alzheimer's, brains that help with memory and thinking can shrink, and they don't work as well. This can definitely impact their brain, and it makes it hard for you to remember things and make choices. Now, what happens in the brain? Well, when people have Alzheimer's, two things are involved. They're called plaques and tangles, and they can build up in the brain over time. Now, plaques basically block the brain's messages, and tangles twist the brain's wiring, and it makes it hard for brain cells to talk and communicate to each other effectively. Now, also, brain cells can die over time, and these plaques and tangles can also cause brain cells to die, which is why people with Alzheimer's lose their ability to think and remember clearly. Now, here is a picture of the progression of Alzheimer's disease, with a picture of a healthy brain, a mild Alzheimer's brain, and a severe Alzheimer's brain. Now, early symptoms can include memory problems, such as having trouble remembering different events, getting lost, and forgetting where you are, and trouble talking, such as trying to find the right words when you talk with others. Now, later in the disease, you could lose certain skills, such as forgetting how to eat, walk, speak, or understand. And this also can cause deaths in Alzheimer's patients, as it could result in injuries, such as choking on food or getting injured by falling down. It, Alzheimer's can also cause personality changes. Some people may become sad or angry, and they may get confused. And they also might need full-time help, which usually happens in the final stage, where they need help with everything they do, from eating to getting dressed. Now, cause of Alzheimer's. Age-related changes increase the chances of getting Alzheimer's, since it could harm neurons that make up your brain. Genetics also play a very important role, as your chances of getting Alzheimer's from 5% to 6.5% come from genetics. And also lifestyle choices, such as not exercising, eating junk foods, or having other health issues, such as heart disease, can also increase your risk of Alzheimer's. Now, currently, there is no cure yet, but there are different treatments that you can do to help reduce the symptoms, which can help improve your memory, controlling your mood, and just help you increase your quality of life while you have this disease. Now, the important thing is prevention, and you can do this by keeping your brain healthy, by exercising, eating healthy, and keeping your brain active, such as reading or by doing puzzles. And studies have shown that it can slow down the disease or reduce the risk of you getting it. Although all this sounds pretty depressing, current research is making progress, and scientists are testing new medicines that could slow down the progression of this disease. And some medicines may even help clear plaques that damage the brain. Now, scans and biomarkers can also help spot Alzheimer's early before symptoms even start showing, which could help increase your chances of surviving longer. Gene therapy is also helping, and scientists are exploring how to fix or change genes that can cause Alzheimer's, and this can also help prevent the disease from happening in the future. And you can help by spreading awareness about Alzheimer's. You can learn more and talk to others about it. And this may not sound like a lot, but it can make a huge difference by raising awareness to other people. And you can also support Alzheimer's research by participating in fundraisers or donating to organizations. And of course, by keeping yourself healthy, you can lower your risk and save your life, as well as talking to others and saving their lives too. Thank you for watching this presentation, and I hope you enjoyed it. And I hope to see you again someday. Thank you.